Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everybody. Welcome to Digital Health Talks. This is Megan Antonelli, CEO of Health Impact Live. And today I am joined by an old, fabulous, wonderful friend and a builder, not an observer. He has done so much in healthcare and in business and has been an ally and advisor to Health Impact for many, many years. In the past, he was Chief Innovation Officer at Cambia Health Solutions. He has launched 6 startups inside a $9.8 billion enterprise. He's advised HHS. He's taught at Kellogg for many, many years, and now is a 3-time published author. And that's what we're here to talk to him about today, is his newest book, Unreachable, and the urgent blueprint it is for staying insight-powered in an AI-obsessed era. Mohan, Nair, thank you for joining us today. Great to see you.
Oh, Megan, it's a wonderful pleasure. I can't wait for this conversation.
We were so thrilled to have you join us at Health Impact in February to talk about the book with healthcare leaders, kind of creating the circumstance for that, right? I mean, we're so focused, on using the technology to drive value or drive a return on the investment, right? And it really does a lot of the time in healthcare come down to money. And to some degree, it's also been where AI has focused. The technology companies want to focus there, right? It's the lower risk. It's less patient facing and drives more resources, and resources ultimately, let's hope to some degree, get freed up to give better patient care. But when it comes to, what are we really going to use this for to change healthcare to make it better? How are you guiding some of your, C-suite colleagues on the healthcare side to think about this?
They are all struggling with it, and I'm glad they are, because I want them to inconveniently learn this too. I don't think it's going to be easy. Anyone who calls themselves an expert in this field is only one page ahead of you. So my third book, actually this is my 4th book, FYI. My third book was on strategic decision making, and it was fundamentally about what to deal with when the world is unknown more than known. And I wrote that in 2010, believe it or not. It's still applicable now because the more of the unknowns have happened. In other words, AI is an unknown. We do not know the impact, the size of the impact of AI. We just know it's big. We do not know the incidence of it. We don't know when it's going to happen. And right now it's happening at a daily basis where change is occurring. So if you rely your backplane of your thinking on AI, you're going to be fluttering around everywhere. You'll be chasing your own tail. So what is the thing you anchor on that truly as an institution you necessarily have to engage on? And in a weird way, and in an almost obvious way, it's your values as a business and how you take those values into actual day-to-day operating table activities, how your people actually perform. Now, in my prior life, I spent 7 years running a software company that had 76% market share in the area of cost and performance management. So I was dealing with a field called activity-based costing. And in that field, the main study was operating measures usually do not tell you what people are doing. They only tell you the outcomes of it. They're mostly lagging indicators. So where are the leading indicators? If you walk down the hallway and people are doing work that is useless, you're probably spending money, right? It's kind of obvious. If people are doing work and are really justifying their work and the work is not necessarily value added, you're probably spending money. So if you can fire people, you can lay off people, but the work get absorbed by other people. So if you don't focus on the work itself, the value added and non-value added work, you will always be shrinking, growing, because the work as a whole is being absorbed and dissolved depending on whoever turns up. So focus on the activities. If you want to apply AI to anything, apply to the necessary activities, removing the unnecessary activities. Caution label on this one instead of nutrition label. The caution label is don't go remove non-financially justifiable activities. Be very careful about that. It's non-financially justifiable that the doctor called the patient when he had cancer. But it was absolutely justifiable in the values you want to deliver, and your Medicare score, because that patient's going to give you a bad Medicare score. And then it's going to be 70 million for every star point that you lose. And you'll just ask yourself, why? We did everything right. Well, one thing you didn't do right, which was that phone call. So I ask CEOs constantly to really align their activities to the values. So it's not a value proposition argument, which, look, we've beat that to the ground. What's your value proposition? How do you measure it? It's really your values proposition that you then use AI to enable. Now, I have customer service groups in healthcare institutions that are now only solving the most complex problems because all the basic problems are being solved by generative AI. You can get on the line and you can solve it. You can send people to the web. They'll do it. And now you're dealing with only the really serious problems. You know what's happening with the customer service people who are only solving every day the most serious problems? They're getting depressed. They don't have any wins because most of the healthcare problems are long-term, emotionally charged problems. So you've got a group of customer service people that are fully engaged like a 911 calls. Every day is edgy. And then you have to add on top of that facilities to calm them down, give them good training, meditation classes, you're now adding even more value to them. And next thing you know, the costs are the same. Mm-hmm. So really give them short wins. So the art of taking away the basics, the convenient learning opportunities are removed. They have no more inconvenient learning is not the way a CEO should think. Don't think efficiency is the answer to cost and performance in healthcare. We've tried that already. And where have it got us? It's got us to $4 trillion still in costs. So if you want to reduce costs, we have to think of it applying AI in a very strategic, directed, contained, and successful beyond the pilot phase. We have 100,000 pilots flying around and nobody's getting anywhere. That gap is occurring today. So my constant advice is, CEO, you better think about your inconvenient learning. You better start showing the example of how you become an instrument of enablement for AI, and exactly you decide what your dining table looks like as well as your boardroom table. And if you don't know that, just telling people those who survive will be the ones who learn AI better, the rest of you have to go, that kind of nonsense is rather boring for me. And frankly, every fact I've learned and every fiction that I'm dreaming of doesn't fit that profile.
Mm-hmm. Well, I think, when you talk about the convenient learning and then to think about, those easy wins, that you're eliminating the easy wins, you're eliminating the learning process, this sort of balance that you're by applying AI to, sort of every sort of easy solution, that you eliminate that. And I think about my kids and handwriting and learning script and that's part of spelling, and it's ultimately part of reading and writing and that whole process that we have just eliminated, right? And without, thinking about the unintended consequences of all of it. And we are rushing, there's no question, in both healthcare and across as individuals to kind of adopt. But what is that, what are we leaving out and what are we leaving behind, which of course is a lot of what you talk about, in the book. So let's talk a little bit, putting on your Chief Innovation Officer hat, right? And talk about what we've seen in healthcare innovation over the years and what that means now. Because I think we're seeing a little bit of kind of fewer Chief Innovation Officers, more Chief AI Officers. The innovation groups within healthcare are becoming the venture groups, if you will. They're the sort of finance investor groups, and there's less innovation groups. And so on a broad spectrum, innovation landscape has changed a bit within healthcare. I think we're also at this build versus buy. I mean, not that everybody in healthcare is going to be sitting and vibe coding, but, they can get into these discussions. And so I'd love to hear your thoughts on what that looks like and what it needs to look like, because if we're putting the, sort of people responsible for AI, in the innovation role, if you will, or supplanting that with that, what does that mean? What does it mean for the kind of pipeline and solution solving, which is what that's what I think of when I think of innovation. That's what innovation should be to me, is problem solving in healthcare. We're not looking for the latest, it's just fix how messed up it is right now and make it better. And that's what your job is, as from an innovation standpoint. How is that changing, or how should AI change that?
Well, when I received the role of Chief Innovation Officer, I really didn't know what that role was. I had to define it, and there wasn't much, job descriptions or things like you have now. Right now, you pretty much know that they're fit into a particular set of choices. Some people in the innovation role are actually portfolio managers. They collect ideas, they enable a process, they help the departments really achieve their goals by being a sort of they're off balance sheet, right? And when you're off balance sheet, you got to change jobs every 3 years, right? Because every 3 years, somebody comes along and says, why are we having that person? And then they always come out looking good because they'll start a consulting company or run off and do something else or join another organization once a chief innovation officer. 24% of chief innovation officers report to the CEO. I was lucky enough to be one of them. When you're in that role, you have a moral obligation and a fiduciary obligation to ensure the functionality of the business meets the functionality of the customer need. There's no more playing around. I'm not implying that people who report to the chief marketing officer or the chief engineering officer or whoever you report to has the same, has less or the same importance, but they are subject to operating pleasures and as well as pressures, as well as budgets. So that doesn't work for me. I mean, if you're not reporting to the CEO as an innovation officer, you should ask yourself whether you have a direct line to the CEO to ensure the consistency across the entire business units you're working with. Because you'll end up looking like an engineering officer or a marketing officer because you report to them. So I had a role where I had 10 people and all of them were business designers, data DJs, I used to call them. People would provide DJ at instantaneous power. I could run into a meeting and they would provide the data instantaneously while I'm doing design. We designed companies and businesses and looked at over 3,000 ideas from employees and turned most of those into operating impactful things within 90 days. Or we threw them away. Or we stored them in the archive. We recycled stories on a constant basis. We were a storytelling group, but not a design thinking storytelling group. We understood the tool, but we did not become the tool. And that happens with a lot of design thinking groups. They end up becoming advocacies for their own design thinking methodology. So you don't need many hammers looking for nails in corporations. We have them with TQM. We had it in the old days. We have it now with innovation. We need business designers who can see beyond the fog and can produce the answers to questions that have yet arrived.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
That's the art of throwing a frisbee. The dog doesn't exist yet. And you're looking at 5 years out all the time because you're in a healthcare business where actuarials look out 5 years. So you need to build a model that is very exciting, that looks at the world differently. But apart from saying, how do I fit into that world? It's really, how do I create that world? How do I create the idea, the insight, and the scaffolding so others can climb? Example, we looked at a social network in 2004 for healthcare. By the time we were done, people were telling us with torches chasing us out of the building. You're going to get lawsuits, innovation companies, insurance companies having a social network. That's like inviting people to come after you. Nothing of that nature happened. We had 1.62 million members on the social network. We created a media company. It had, at that time in 2004, had movie making quality. We made documentaries. We produced interviews. We did podcasts. We were podcasting before podcasting occurred. All that was created from the minds of the genius of the people around us who could just close their thoughts and open it to the future. That became a very successful play for us competitively.
Yeah.
Was there people filing lawsuits? No. Was there people yelling at us? Yes. but not that much. They were talking about their kneecaps. They were wondering about depression. You know what the top 3 things were in the social network over a 5-year period? Divorce recovery, relationship with children, and then their own mental health. Those were the key ones. So when you watch that, you start to realize your member base is actually talking about things that are really substantive to their lives, and you could feed your products and services to help them, not to manipulate them.
Right.
So that's the role of a chief innovation officer. See the future, build the scaffolding. An AI officer is dangerously close to being a hammer looking for a nail. They're going to be highly trained, depth first in the AI function. They're going to be less domain knowledgeable. And even if you put that in the senior officer ranks, you have to test that AI officer to ensure that the respect for the domain and the values driven by the domain have to be replicated. They can challenge it. They should challenge it. But they have to not challenge the fundamental core premises that drive healthcare to what it is today and what the social commitment we have. So AI can be, you can build anything in AI, but you have to understand the necessary domain that made it happen. Starbucks had brought an efficient leader into the play many years ago. That person hermetically sealed all the coffee in all the retail stores. And Howard Schultz could not smell coffee when he walked into the stores. It didn't work. It was highly efficient. Supply chain was successful, but there was no smell of coffee. And that's the thing you don't want AI officers to lose. They cannot lose that. They will come in big and bold, and my best friends are AI officers now. But combining the innovation role with the AI officer role is dangerously close to realizing that you don't need an innovation officer. But that's not because you didn't have a great innovation officer prior. You just didn't give that person enough room to kind of design the business structure that's needed. Medicare pricing is dropping. Reimbursement is falling. Individual to group margins are crashing. The negotiations between individual insurance companies and hospitals are becoming more tenuous. Hospitals are not able to function because they've relied on commercial business to support their Medicaid business. Now the commercial business is sub-zero. So they're relying on Med Advantage. But the Med Advantage star ratings affect you. Not only that, the ability to handle Med Advantage now with pricing structures changing is reducing your margins. Where are you going to get your survival dollars? How are you going to function? Those are not AI problems. Those are real business model problems. And if somebody says I can make nurses better, that's not the real problem. You can, but it's not in your zero-based budget where you want to put your artificial intelligence solutions. So my field of work is to help others understand that the dining room is still the place to be. That AI applied to the dining room will automatically apply to the boardroom if you know how to play that very successfully. And you have to be shrewd about it. Now, in terms of everyone being an enterprise, every person in the healthcare systems, they think now they can be their own consultant. They can also be their own innovation officer. They can also be the one-person enterprise. I had a CEO tell me, who has only 5 direct reports, he's running a significant business, and he said, I hate humans because they're so boringly, problematic. I just use AI agents now. I have 5 directs, and I want to empower my directs to create agent technology, and I get updated every day and night, and I can get all the data I want. And he's looking at me and saying, if your book is telling me this, I agree with your book. If your book is saying that everyone has a right and to be AI enabled and insight enhanced, then I think it's wrong. It's completely wrong. And we had a long walking argument about that.
Yeah.
But that is the world we live in now. There will be
and I think what I'm hearing and what I think there, there's this element of innovation that is about knowing the future and also understanding the past. And AI is an incredible predictive tool based on the past, but without the human insights that are needed to predict the future realistically, you can't necessarily do the right thing. You'll just keep doing what you've been doing before.
Or you would do what other people have done before because it's the large language model that you're using.
Right, which is completely counter.
Yeah, and it's also, by the way, AI, Gen AI is combinatorially powerful. like drug manufacturing. I mean, OpenAI just signed a deal with, I think, Novo, and that's because they want to do drug design. They'll do a great job of it. I think that they'll find new and unused components that can be reused into the drug arena, and that could take their life to a whole new level. But the fact of designing the next original drug combination, you may leave to the machine, but the fact of designing the next new drug is going to be found somewhere else. It'll be
it's also an example of using AI for the problem is, I mean, they're saying Mounjaro and the Lilly product has gotten market share. Well, it's gotten the market share because it's more effective. Sorry, Novo Nordisk and all my friends there, but it's more effective. Therefore, you can throw any AI tool you want at it, but that's not going to change that, right? So we're throwing the tools, using the tools, but if we don't fix the fundamental problems, and innovate better to fix those problems, the AI is only going to, give us the same results, right?
I mentioned to you about activity-based costing and how if you fire people, the activity still remains. The power of that is if you look at the activities that truly you need to perform now, don't look at the jobs, but what activities make you AI unreachable? And those are not the repeatable, scalable ones. Those the machine will do. The documentable ones, those are seldom. So the intangible set of activities that you perform that create the solution space that nobody else can create. So think of yourself as a master chef. The ingredients you have are the same. Everyone has the same ingredients. So if you try to protect IP by protecting the ingredients, hardly will work. But it's that final touch, that chef's touch, that generates the beautiful, undeniable taste that is found. And people go, how did that happen? I mean, how did it happen? Now, I always kid around, right? Megan, you can come to my house for turkey dinner at Thanksgiving. I guarantee you will leave quickly, right? But I could go to a master chef. The person uses the same ingredients, same proportionality, and it tastes beautiful. What is that difference? And we always like to mechanize our jobs. But the patient relationship between the equity of the relationship between patient and physician and nurse and caregiver, not repeatable and scalable. It's fundamentally, uniquely driven around stories. It's driven around stories. So let me share with you one quick story. I went to my mother's memorial in New Zealand, right? It was so horribly done, it was beautiful, right? Because there were 11 people who died, and the nurse was the guitar player. No, the laundry person was the guitar player. The nurse sang, and they sang, Stand By Me in off key, right? And each one of us went up and talked about our loved ones who had passed. I had 4 minutes. I stand up and talk about it. Everyone in the room is crying, including all the nurses that took care of my mother, right? Tell me you can AI that one.
Right.
Right. Yeah. Do I care that they sang it off key? In fact, I love they sang it off key because they sang.
Right.
Right. At the end, we took balloons and helium balloons, now more expensive than ever, but helium balloons. And then we took it to the sky and all the nurses were out there. And when they talked about the patients that didn't have family members who passed, they couldn't finish reading their scripted communication. And I know that scripted communication was written with Gen AI help. They put it through the GPT because it sounded so profound, right?
Right.
But they couldn't finish. That's the thing that is unreachable by AI. Right. That's just an example. The commitment they had to the patient that traversed everything. Now, in the back of the room is the general manager of the retirement village. He's bawling. He's bawling at all levels. Mm-hmm. And one of the persons I invited to come with me, one of my close friends, said to me, "This is how I want to die." And that is...
No, but that's it. It is about the humanity of it. And if there's no place where it's more important than healthcare, right? And so I think that's why these conversations are, resonate so much, and the thoughtfulness that's required and the time that we are taking to think of how we do this is so important. And that's, sometimes I get a little concerned as I'm at these conferences and it's just adopt, go, go, go. When, it really is something that while the power is there, the promise is there, if we don't take it and be methodical about how we adopt it, we lose that humanity. So I think the book is so important. And, I'm so glad that you wrote it and that we're able to kind of amplify that. Tell our folks, I know it's available everywhere now. Tell our folks where they can get it.
Well, first of all, thank you, Megan, for giving me an opportunity, a platform that I totally respect, and I always respected the platform you've created because it has the balance of what we just talked about, the efficiency, the effectiveness, and also the compassion required to really win in the markets. I made sure the book was available to as many people as possible to get to the dining table. So I didn't make a hardbound. I made a paperback and Kindle and ebooks. So it's very inexpensive. So it's easily accessible to everyone. I'll make my money when it's turned into a movie, and then that's when I make my money. Just kidding. But it's available on Amazon. It's available everywhere. It's an Amazon bestseller already, which is very gratifying. But any bookstore will not carry the book. You'll have to tell them to buy it because I decided not to put it in bookstores. I prefer to put it in the web world so that you can access it and get it delivered to your home. And so every Barnes & Nobles, every ebook store will have it. The actual bookstores that will also have it, if you just call them and ask them to order it, it'll be fine if you want to go pick it up there. But the bottom line is connect with me on LinkedIn. Join a movement with me. I'm seriously trying to be a nutrition label for people who are indexing over on the left or the right. They need to be in the middle, really focused on what their true insightful self is and bringing that out. I mean, insight is known as a sudden comprehension or realization that solves a problem. And you know what? That happens all the time if you don't notice it well. You just ignore it. Every time you get an idea, that's because you don't build. And now our cognition is threatened. I think our cognition will be threatened more and more. And if you're worried about you and you are 40 years older than normal and like me and you're beyond your years, I'm not worried about AI taking my brain. Health and age is taking my brain anyway. And pure laziness. So I'm not worried about that. The problem is the younger people who have not formed their cognitive agency yet. When they overuse AI, their degradation is higher. So our next generation, or generations to follow, are what you should be concerned about as a CEO. Make sure their cognitive strategy is to ensure that they use their brain as well as they use the machine.
For sure. Mohan, thank you so much. It's always such a pleasure. I look forward to our next conversation. To our audience, please, Unreachable, How Not to Lose Your Mind in an AI-Obsessed Era, available on Amazon and barnesandnoble.com. And get out there, read it. And then, we want to hear what you have to say. And if this episode has given you something to think about, subscribe to Digital Health Talks and follow us on your platform. And we will be back next week to have more conversations. Don't miss what's next. This is Megan Antonelli signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.